Okay, I'd like to call the June meeting of the Human Services Committee to order. First on the agenda is the approval of the minutes. Do I have a motion to approve the minutes?
Second.
Second, all in favor?
Aye.
Privilege of the floor. Do we have anyone here to speak to the privilege of the floor? Anyone to speak to the privilege of the floor? Seeing no one, we will move to our first proposed resolution, which is setting transportation stipend for the Chautauqua County coroners.
Good afternoon. I'm Anthony Shekels, Coroner Supervisor for Chautauqua County. So we just got I know we've worked on this for a while, but the truck is in. It came in this month. It's at Schultz's, getting some work done on it, so it'll be able to hold the cots and everything and lights. So we need to set some kind of pay for the coroners if they're gonna actually do transports. This isn't for me, it's just specifically for the coroners. If they wanna do a transport to ECME or within the county, if necessary. There's nothing really in the system right now to pay them to do that. They get $150 a call plus their stipend. So this would be $250 to transport to Erie County Medical Examiners and back. And I think that's gonna take them about 4 hours. Because once you get the call, you do your paperwork, you recover the body, you go to Erie County and you come back. It's probably about 4 hours. We currently pay transport companies, the local funeral homes that have contract, on average with mileage about $475 a transport. So if we're paying our coroners $250, and then we're using our own vehicle, I've done the math. You can figure it's gonna be between 34 cents to $1 a mile, depending, because it's a 3/4 ton truck. So I figured it at 75 cents a mile. I'm guessing another $100. So what a transport's gonna cost the county now, when they do them, would be about $350. It's $100 savings overall, and it's really kind of worked into our budget because we're already budgeting for transportation.
Okay. Do we, what do we pay the funeral homes and stuff for within Chautauqua County?
That's what we're paying. It's 400.
It's $450 no matter
450
where?
plus mileage, so it's usually about $475.
Oh, so it's
transport.
$450 plus, or $475 or
But 450 plus mileage.
plus mileage?
So I was just,
All right.
I went and averaged
Okay,
it, so it's
okay.
about $475 a transport.
All right. All right. And we are providing a salary range of 2,500 to 15,000.
Right, currently, the stipend that all the coroners are getting, they haven't had a raise in years, is $6,000 a year. By trying to save some money, and we are reducing some costs even with autopsies. Our coroners are doing a great job doing investigations. I've lowered the autopsy cost because the coroners are doing good investigations. They used to charge us $350 an autopsy for the investigation. But with our coroners a little better trained, that's not happening as frequently now. It happens once in a while if somebody drops the ball, but that's saving us, I'm guessing $5,000 to $6,000 a year. And now this will save us another couple $1,000s a year. When we get to the point where we can draw blood, we've been approved for a contract, that's gonna save us a significant amount of money. We're just waiting for contracts to be approved. And then I think we could probably come back to you and justify a raise for the coroners.
Okay. Any questions for me?
It's a sensible thing to look at. We've been down this road before. Years back.
Okay, Dan?
How many trips would you say, you know, just on an average, just so we kind of have
So-
an idea? And-
I'm guessing the coroners will probably do half the trips.
Okay.
And I'm saying that because we used to average about 50 trips a year. We have one truck. Getting that truck and making it available to everybody is gonna be, they all live all over the county. That's gonna be a little bit of logistics of a problem. I do kind of have a plan in place for that. I'm hoping we can do at least half, it may be more. A lot of the transport's happening during the day, and when I'm working, I can transport if somebody else can pick up call. And that is a huge cost savings, because I wouldn't get the $250 a trip. So it's gonna be hard for me to say until we actually have a vehicle in place and we're operating under some sort of policy. I've written policy, but until we actually get to where we're using something, it's hard for me to say that that's the right policy.
Yeah, I think it's a decent pay. I mean, it's not low, it's not terribly high, but it's worth someone doing too, so.
I wanted to make it attractive for them.
Yeah, so someone would, I get, maybe being under in other areas, this is a good little way to help them, but, as long as we're not helping them and then help them again and later elsewise,
Right.
right? So, I'm okay with that, and if you're gonna be able to pick up a lot of them too, that's helpful. But, we are looking at having this truck and the ability to do that for the savings. And,
Correct.
$130 of savings isn't huge, but it's a savings, so.
Right.
Okay.
Mr. Chairman, if I might,
Sure.
could you explain the reason that the provision is added for the pay for any transport to a location within Chautauqua County?
So sometimes, we have a problem, like the funeral home might have a funeral that's been requested by the family. So we can either just sit there on scene and wait for somebody to be able to come and get them, or we could actually deliver for the family. Sometimes we may not know who the person is, but we don't necessarily need to send them to Erie. Because we just need to do a little follow-up. We could transport them and store them in we currently have our morgue. We could store them in the morgue while we figure some things out. There could be any number, of reasons why we may have to. Most of the time, it has to do with availability. The funeral homes get busy too. And instead of sitting for 2 or 3 hours on scene waiting to release a body to a funeral home, if we could just take that body and drop it off at the funeral home, it's a time saver for them, it's a time saver for us. It really, I think it works out best for everybody. We do about, I don't know, since I've been here, we've done 3 or 4 in-county transfers, where we've had to hire a different funeral home to transfer the body. It doesn't happen that often, but if we didn't put it in there, and that's what we pay the funeral homes for an in-county transfer, it's really no savings. We're just passing that money on to the coroners, but I think it's necessary to be in there. I don't think it's something we're gonna do very often, and I'm not gonna let it get done very often. Because I know there's places where, when something like that gets written into law, then the coroners wanna transport everybody, because I know there's places that do that. We are not gonna do that. That's not gonna happen.
Thank you.
Anything else? All in favor?
Hi,
Thank you.
Well, thank you very much.
thank you.
Okay, next up on the agenda is, we're going to switch resolution number 3 with number 2, because it makes more sense. So proposed resolution number 3, which is authorizing agreement for the Children and Youth with Special Health Care Needs Program.
Hello, Lacey Wilson, Public Health Director. So the agreement here, or authorizing the agreement, this is really just a housekeeping item tonight. This is a program that is a mandated program through New York State. This is something that's been done here for years and years. We are just in the new funding cycle. And so we are here to ask for that approval to renew the service that is mandated through New York State. So the SHIN program is Children and Youth with Special Health Care Needs. This program serves typically between 200 and 300 children every year. And the state does provide some funding, to do this program in terms of some staffing and really specifically for the services for the children.
And that funding was $38,740.
So, no, I think that's the other, you're looking at the other resolution.
Am I? Did I? I switched it and then I.
We switched it because we thought you'd want to talk about the
Okay.
program first before the
Yes,
project
yes,
that we have
yes,
for you.
yes, yes, okay. I didn't go far enough, I'm sorry. So $334,340.
Yes.
Okay. That makes, it's better. And this, how long has this been going on?
Honestly, I would have to look it up. I mean, this is one of those ones that's right embedded with our early intervention program for years. I mean, 15, 20-plus years.
Okay. Any questions or comments, concerns? Anyone? Okay, all in favor?
Aye.
Aye. So we will go back to number 2, where
No.
I was stuck in for a long time. Proposed resolution number 2, which is authorizing agreement for the Children and Youth with Special Health Care Needs Program, Community Accessibility and Inclusion Component.
Yes, so the resolution that we just went over, in regards to the overall program, this is a new area of funding that the state has now provided. You are very well aware as the Human Services Committee of just the needs that we are seeing in young people nationally, not just in New York State or in Chautauqua County. The state has recognized that and is looking for ways to unlock other funding for us, like this pot of money, to better serve this population in a more specific way that intervenes really where we need to locally. Because of course, county to county, the barriers for families and children that, you know, are experiencing these needs can be very different. So this is funding that allows each county to develop some intervention strategies to better connect and more efficiently connect these children and their families with services. So this is the opportunity for us to accept this funding and develop our own program within the standards, of course, that the state sets to better serve the children.
Can you explain the program a little bit? as
So
you're
we,
thinking?
of course, because, you know, I'm very planning heavy in my background and my experience, we have a strategic plan together for what we would like to do with these funds. We have to first, though, have it approved by New York State. So you accept the funding and then really work alongside the state to, you know, develop what, under their technical guidance, really what they would like to see happen, as well as your individual experience in the county. So what we would like to do is build on what we're seeing a lot of success in our early intervention program, which are these group services that come together. So one of the things we experience, as you all know, is our providers in our community, specifically in regards to OT, PT, speech pathology. We are in dire need of these professionals. When we cannot, you know, find and recruit these professionals, of course, then that creates rate increases in a lot of ways. There's a lot of demand there. So the very well-versed staff in this division, Denise Nichols and Wendy Douglas, have piloted this group program, which brings the families and children together in community sites to receive these services and training together. So the provider gets a higher rate because they're seeing multiple children at once, but it actually costs the county and the state less money because we aren't paying a higher rate per individual child. We're paying, you know, a lesser rate for all of them together. We're seeing this really interesting supplemental effect occur as well, just in regards to the social component. So whereas these children and families would be receiving these services on an individual basis, maybe in their home or in a school setting, now they're coming together and there's this really neat blossoming of relationships and social support that's occurring. So it's basically a no-brainer that the state is going to accept our project because they've been very happy with it, but we technically do have to get their approval first.
And we piloted that program?
We basically, yes, piloted this. I mean, this is a model that's been used in other realms of the world, but never with early intervention services. So we were really the first in the state to do this.
Any questions? Okay. All in favor?
Aye.
Aye.
Thank you.
You're welcome, thank you. Okay, so that is it for our resolutions. We do have a discussion of a Veterans Affairs Vehicle Update by Greg Carlson.
Good evening, Greg Carlson, Director of Veteran Services. I have a discussion topic, which is the current status of the veterans van and the future of the veterans van. I took some notes here. There might be some minor typos. It's really just a guide for something to discuss. So I'm going to start with the status of our current van. It's approximately 10 years old. It was purchased with discretionary spending gifted to the county by Kathy Young when she was the state senator. With the veterans van starting to hit its shelf life, we reached out to George Borello to see if they had that same discretionary spending. They do not. So that's kind of the starting point. Right now, the veterans van is actually not operating. They're sending it to Ford on June 30th, so we have been renting a carts van in the interim, which is getting quite expensive. We have that, we're doing that through the month of June because we had commitments. In addition to doing the weekly trips to the Buffalo VA, we also had an honor flight and then Boys State. So since we had the van reserved for that a few months back, we're honoring those commitments by renting a carts van.
So it's not operating because it's not operable.
Correct.
Okay.
Yes. It's not operating, it's not, but we are still operating. We're just renting a carts van to do what the veterans,
Program's operating. It's
to
just
do
not-
what the veterans van did.
Okay.
So I sat down with Michelle Westall from Carts, and we went over a bunch of different numbers. Now keep in mind, these numbers aren't to the penny. They're very close representations of what our operations and maintenance would be, given the recommendation I'm going to go to on page 2, but I thought I'd go through these things. So what's recommended in the top, where it shows the driver's hours, fringe benefits, project coordinator, et cetera, that is what we're currently paying with local share. So that's something that we're doing now. The only difference is with the idea that I'm going to propose to this group for further discussion, there is a reduced cost for maintenance. So right where I kind of like embolded and italicized the mechanics, where it shows a $595.80 annual cost, that's what it would be if we were to go with a different option. We're spending way more than that in maintenance now, to the tune of thousands of dollars. And then if you add in the cost of renting the carts van, that's even higher. So total cost of operations and maintenance minus fuel. Fuel is billed directly by Department DPF, is about $33,000 a year. So that's what the Chautauqua County taxpayers are paying to operate the veterans van that we have now. Currently, we have a wheelchair accessible 16-passenger bus. Now, it says van, but really it's a bus. If you've seen the veterans van, it's less of a van and more of a bus. The cost of a new bus would be $136,500, and that would not be available until the fall of 2026. Not the money, but the actual bus itself, because Carts is not able to get theirs until that same time, so they can make the order in about February. And Michelle could tell you more about the contract with the Department of Transportation and why that is. But even if someone gifted us $140,000, we wouldn't have the bus until the fall of 2026. And our current veterans van may not make it past June 30th. Hopefully it is. That they think that the fix is a computer thing and it shouldn't be too bad and we should be able to get it back on the road, because it doesn't seem to be a mechanical issue. It's just more of a sensor issue, but they still can't drive it just for safety reasons with the problem it has right now. Let's see here. Okay. Bus runs twice weekly to the Buffalo, New York VA Hospital. Every Wednesday and Friday, the bus goes. So we pulled the stats. For calendar year 2024, we averaged 2.87 riders per trip. And that's even including escorts. So that's everybody. So everybody who rides the bus to the Buffalo VA for doctor's appointments, for medical care, it's 2.87 for 2024. January through May 2025, we're averaging 2.77. There's not really a decline. It's not really statistically significant. If you look at the history of the veterans van over the last 20 years, it has progressively decreased. Right around 2019, 2018, it kind of leveled off to that number there, between 2 and 3.5 riders per trip. And then there was a dip during COVID, obviously, and then it climbed back up to the current level it's at now. And it's been, if you look at 2023, 2024, and 2025, you're in that 2.5 to 3 range. So if you go to page 2,
Would you,
I'm sorry, go ahead.
on that, would you say that there's like 6 people this week, 2 people this week, none the next week?
There's the most we've had in a single ride is 7, and that's exceedingly rare.
Okay,
So you're averaging 1 to 4 passengers per trip.
okay.
Yeah,
And-
rarely less than 1, rarely more than 4.
Okay,
So that 2 point, they usually have. Now, what I will say, and I don't want to get into it because I don't want to get in the business of questioning veterans who use the bus. I can say that 6 people account for 44% of all rides. So this isn't 2.87 different people. It's, yeah. And then we have 1 person who accounts for 21% of all of the rides. So they count each trip, a trip there and a trip back, right? So that's 2 trips. So 52 weeks a year, twice a week, you have a couple of weather days in there. So we have somebody taking 40 to 50 trips per year to the Buffalo VA, which is fine. The service is there. It's along the route, but just giving an example of how the numbers, but I didn't even get into that. We average between 2.5 and 3 riders per trip. So, if you go to the next page, there's a couple of different solutions to keeping the veterans van going. One is purchasing a new van. That's not realistic. Or not purchasing a new van, purchasing a new bus. That's not realistic because we don't have $140,000 on hand to do that. Additionally, a 16-passenger bus we don't have the ridership to support that. Doing away with the van, we still do have veterans who need the trip. There are still veterans in need who do not have transportation that use the bus to go for necessary medical appointments in Buffalo.
And we could assume that in the future, there will be veterans who don't need it right now, but will need it in 2 years, 3 years. Can we assume that, or?
Possibly. And there's a whole lot of factors that go into that. I'm going to say it's more likely there will be less than more. And that reason is the number of people serving is far less. So 50 years ago, well, actually, I'll go back to the late 1960s, 20% of the population had served. Okay, so there was a continuous draft from World War II to Vietnam. 20% of the population had served. It's now 7%, right? So that number has reduced. Active duty, we have about 1.1 million if you count all the services together. During post-World War II through the Cold War, we had somewhere between 2.2 and 2.5 million veterans. We also used to have a force that did a short period of time. It was a lot of young people. They would abuse them physically for a couple of years, and then they would move them out. Now, 55% of the military is career force, meaning they're beyond their first enlistment because the jobs have become less labor and more highly technical fields. Yes?
I just have a question. If special events is a problem or prohibition to doing this new plan, would we be able to rent the CARTS bus for a special event?
Yes, that's feasible. That was just, my pros and cons were just quick little discussion points. So the idea, and actually it was Marty who had me think of this idea, and then I talked to CARTS, and they reached out to their the proposed solution is to lease an 8-passenger wheelchair accessible van. This would do a couple of things. One, it would meet the need that we have and be more appropriately sized. So instead of having a 16-passenger bus, We have an 8-passenger van. Bear in mind, we have not had more than 7 in a single ride, other than for a special event, in several years. So the 8-passenger van would do the trick. You do not have the upfront cost. Fuel wouldn't be as much. A CDL is not required to drive the van. Maintenance would not be as much. And with a lease, every 2 years, you could reassess the need. As opposed to you purchase a van, you're looking at an 8 to 10-year commitment plus increasing maintenance costs each year. So every year we have the van, the cost of maintenance goes up for the van. The big con is that you would add about $18,000 per, that's high end. So they weren't able to give us exact numbers, but they gave us a WAG and they said, don't hold us to it. They went high end, about $1,500 a month, and that includes the lease with the amount of miles we would need plus insurance, the other like costs there. So it would, right now we're spending about $30,000 to $35,000 a year of local share on the veterans van. That would increase to $50,000. There would be some cost savings, but not enough to offset the cost of leasing a van. Yes.
What is the residual value of the current vehicle?
They can auction it off for about $1,500.
Seriously? Wow,
That's what I said.
that's crazy.
Yep. Because that was why, so one of the plans that we had come up with is that when Carts auctions off their vans and they get their new, we get the best of what they have left, because they would only be able to auction it off for that type of price. So it wouldn't be a new van, but it would be in better shape than the 2015 version that we have right now. And then kind of the same thing, every 2 years, we would get the best remaining Carts vehicle. But that's not even feasible at this point because our veterans van's not gonna make it that long. So we're not gonna be able to wait until the fall of 2026. And then even if we waited to the fall of 2026 to get one of Cart's hand-me-downs, you're gonna have a lot of the same maintenance issues. You're gonna be taking a 16-passenger bus to take 2.77 people to Buffalo twice a week. So, and you could kind of see my list of pros and cons. Now, keep in mind, this isn't all-inclusive. This is something I threw together after my meeting with Carts, just to give, this is a discussion.
Right.
It's an opening point, and it's, do you want me to move forward with the lease, understanding that we are gonna have to increase the budget to do that? There is a need. I'm not gonna say, I'm gonna say a lot of veterans do ride the van for something to do, but there are still veterans who do not have transportation, who 4 or 5 times a year are required to go to Buffalo for important medical appointments. So there is still a need. So, I mean, I wouldn't just say, hey, we just need to do this because it's popular. With that being said, it's very popular, and if you say the veterans van is not going to remain, it will create mayhem and chaos. And
What do other counties do?
other counties, they don't have a veterans van that's like assigned to the Veterans Service Agency. It's legions, DAVs, grants, nonprofits. I reached out to several other counties and say, hey, do you have a county-operated veterans van that you pay for? And the answer to that question is no. Also, depending on what county you're in, like if you are in Erie County, everybody's right near the Buffalo VA Hospital. There's no need for that type of service. Same thing for Syracuse, same thing for Albany. If you go to like the North Country, they're up near Watertown and those types of places where they don't have a van that's going to take people 2-3 hours to Syracuse, to the closest hospital. So they use the community-based outpatient clinics, or they do care in the community. Cattaraugus, they do not have a veterans van that's assigned to the county, but they have a DAV van that takes people. When I say they, the county does, not the
Right.
the residents of the county, not the county government.
Right, yeah.
There you go. Sorry, I got to specify. I say the county has it, not county government. So they do have a transportation available, but it's not a county taxpayer-funded thing.
So if the availability of the 8-passenger lease is much sooner than fall of 2026?
Right, so what we're hoping is that the veterans van fix, because we did put some money into new doors and new windows to make it drivable for this year. We're hoping that it is simply a computer sensor fix, and when we send it to Ford, they can do it for a reasonable price, and we can keep that on the road until December 31st and effective January 1st. We could probably get the leased vehicle in a couple of months if we moved everything quickly. But a realistic timeline, since we're already almost to July, is January 1st. And then for budgeting purposes,
Exactly.
it would make it a nice, neat, clean thing.
In the interim, you're using a Carts bus right now.
For right now, we are using, but it's expensive. It's expensive to rent, it's expensive. Let's just put it that way. So I have it committed through June 30th because I didn't want to not honor our honor flight commitment, not honor the Boys State stuff that had been reserved, and then, of course, the trips. So, but as far as what we're going to do moving forward, it really depends on how quickly we just don't know what we don't know. Probably, because then this was talking to their maintenance, but they don't know, probably it's just a sensor thing that they just can't fix there that Ford can fix. That's the probability of the problem, but they can't say for sure. So we're kind of banking on that we'll have access to the veterans van after it goes to Ford at the end of June. And that's as quick as they could get it in.
How many miles are in that current van?
Close to 200,000. Hard miles.
Yeah.
Can I say a couple
Sure,
words?
absolutely.
Don't take this the wrong way.
Sure.
But, you know, I've been on the legislature a few years, and I've, knew that our van has been steadily depleting.
Mm-hmm.
And it's been on something I've asked about over the last few years because, we really needed to make a decision before we got into this position, Even a couple of years ago, we had the ARPA funds come up, and I had mentioned it may be a good time to replace the van because we have, the ARPA funds to be able to do so before we got into a position where our current van was just no longer, So it saddens me we got into this position a little bit because I've been asking about it, but now that we're in the position, I think we realize we need to keep the van, so unfortunately, we have an increase in local share of that 18,000, but, there could be some potential other funding sources that could purchase the van. Do you know what a purchase price of like an 8 or 10 passenger van would be? Utilizing some interest from ARPA funds, we still have some of those available that could potentially be used. It just trying to think outside of the box a little bit, and
Sure.
It may help. It's a one-time expense, but it doesn't hit your budget year to year moving forward. Okay,
Right.
Now, it puts it so you need to have the van in some sort of a replaceable cycle, so you don't run into this in 8 years from now or something. You know what I mean? So it just needs to be thought out a little bit in that sense, but it just is a potential option. I thought it may save you the 18,000 extra increase in local share a year. Do you know what the replacement
so-
cost would be of that
So
size?
for that type of vehicle, and of course it depends on the options you have,
Sure.
but you're looking at a $75,000 to $90,000 purchase for an 8-passenger van that's wheelchair accessible, that's going to have all of the same. It depends on the options you get, but it's 75 to 90,000. And as far as what you were saying, you're 100% right. Like, this is something that we knew that was coming for a period of time, and it wasn't something ignored. What we did is we took a look at the use of the van and what the cost was and what some of the options were outside of having a county taxpayer-funded van. And we were looking at, hey, there's other things that we can do outside of this to just allow the van at this point, like when it first, so when the van first came to be, it went 5 days a week. 3 days a week to Erie, 2 days a week to Buffalo, and it was filled. And then over the years, it has declined to the point now where we go twice a week with an average of less than 3 passengers. So we were gonna keep this van running as long as it possibly could and invest the money to do that and just let it end organically because it made the most sense from a fiscal standpoint. The bottom line is the public isn't ready for that.
Would it be ready in 8 more years? You know, let's.
Well, I'm telling you that, and I mean this, I want to do everything I can do for veterans. As a matter of fact, I like to do claims to get people to the 30% rating so that they get paid mileage, right? So that they can go there. And the more people that we can get to the 30% rating, the more money that comes into the county, the more people that get paid mileage to go to the Buffalo VA. But it was very apparent to me when I said, hey, we're going to allow this to happen, that the general public is not ready to allow the veterans van to go. So we're here. But you're absolutely right. You did bring it up. It was something that we had thought about, but when we looked at the dollars and cents at the time, and it's not, and again, I'm not putting dollars and cents on people.
Understood.
Anytime you take anything away from anyone, or the perception is that you take something away from someone, it's hard, right? So you've had this service, it's been around for 30 years now, a van of some sort. It's gone through different iterations. When you get to this point where you're like, hey, we're down to this many riders, but you're absolutely right. Yes, this is something that has come up. In my mind at the time, I couldn't justify taking over $100,000 so that one person could take 40 trips to Buffalo. I mean, that was my thought at the time. I might have been short-sighted. I tend to do that, not purposely. Yeah, no, I understand. That's a completely valid question,
Yeah.
though.
Thank you.
So I guess moving forward, we see where we're at with the repair of the current van and then just do research on purchasing a new 8-passenger versus leasing.
Okay,
I mean,
so,
that's a 2-year lease?
yeah, so that's typically, so the person who does leases for cars, they typically do 2-year leases.
Okay.
That's their standard. I'm sure you could go shorter or longer, but that's their standard, what they do. Hey, we do a 2-year lease, that way they can reassess the need every 2 years for the
So-
lease.
Yeah, I mean, we do, if leases go up, but just quick math, 2 years in a 10-year period, 2-year lease, 5 cycles times 18 is 90,000. But that includes insurance, you said, or,
Well, that's
Guessing.
that's the high end, and then you're also looking at cost versus the bus. Maintenance exponentially lower,
right.
gas exponentially lower. How that works out, they don't know because they
Well-
don't have the data. They go based on what
But-
they have.
Well,
now.
what I understood, what
Yeah.
Dan asked, was the cost of the 8-passenger.
Oh, I got you. Like
not-
to
not the
purchase a
bus.
van
Yeah, to
as
purchase a
opposed to,
van
yes,
is
that is something we could look at.
75 to 90-ish,
Right.
where, you know, of course,
I think, obviously buying a big bus isn't what you need, you know.
Right.
So I think looking into that smaller passenger vehicle, still needing it to be wheelchair accessible, and still being able to haul at least 6 or 7 people, because
Right.
once in a while you get that many. And I think obviously you fit the program for what you have, and if you all of a sudden on Wednesday, you got 8 people, you're like, hey, can we?
And that's where you can, in the very unlikely event you would get to that, you can prioritize.
That's right.
Hey, you need to show me your appointment.
Yeah.
You know, if you're going up there to volunteer, you're gonna have to sit this one out. If you're going up because you have to see a cardiologist.
That's right,
You-
yeah. You have
yeah.
to be a little selective, which is a good thing to have. And
Right.
if you had to reassess and get a different van, great, but.
Right. And yeah, that's, I mean, for right now, that's what is, and what I can do is I can go forward and see, all right, let's actually put a pen to paper, give me an actual quote for, this was a fact-finding mission.
exactly.
And we wanted
For
approximates,
today,
hey,
yeah.
what would it look like for the discussion and see like what are the options can we buy
Yeah.
versus, and kind of when this happened about 10 years ago, I was reviewing all the paperwork and it was kind of the same thing, like, but at that time, the van was used a lot more. So at the time that they made the purchase about 10 years ago, it was the same type of thing. Hey, the old van was going kaput and they needed a new one, but at that time they were I don't want to say gifted. There was discretionary spending that came from Senator Young, then State Senator Young's office, to purchase the van.
And, you know, Greg and I talked about this last week, and it's like, okay, let's get this in front of this committee here. So this is a week's worth of work, I'm assuming.
Oh, I had 2 or 3 meetings with Carts to include
Yeah.
going in person, researching kind of the,
So, yeah,
you know,
yeah, you've done some work before, but
in the notes
this is
and
preliminary to,
even the discussions to, hey, are we gonna keep going with the van, or is it time to retire the van?
Yeah.
Or donate it to the local clubs? But the problem is, the minute you mention that, it just, people aren't ready for it.
right. And we want to do what we can.
Oh, absolutely. And when I did look at it, there are still a handful of, there is a third option, but good luck managing it, and that would be if you contracted with someone on a case-by-case basis. You set a criteria that, hey, if we have a veteran who doesn't have transportation, doesn't have a disability rating that warrants the mileage paid, we could, on a case-by-case basis, set up transportation. The benefit of that is it's more flexible, and that, hey, if someone has an appointment on a Tuesday, and we don't normally go on a Tuesday, we could accommodate that. The negative, you open Pandora's box that way, because then it becomes, you know, everybody wants to use the personalized service as opposed to their own means of transportation. So you wouldn't have to have the big budget for it, but it also wouldn't be the weekly veterans van trips that go to Buffalo. So I didn't even really put that on there. I just talked about, hey, 16-passenger bus, not needed, too much money. 8-passenger van's probably the right way to go. Now we can look at purchase versus lease. The thing I liked about the lease versus the purchase is, in 2 years, what if ridership's down to 1.2 per,
Right.
you know,
If
trip?
there's built-in flexibility there.
Right.
We get a new van, so in 8 years, we got an 8-year-old van if we purchase it with the accompanying maintenance issues and
Mhm.
potential repairs versus a new van every 2 years or 3 years or whatever. So,
I get that, and, you know, and my point was is just that it becomes an expense to the department in a different way. So
Well, in
a one-time
different ways, sure.
purchase is one
Yeah.
thing for the different
Yeah.
account, but now moving forward, if we lease, now it's a new expense on a local share of the.
Oh,
lease
right,
expense,
yeah,
you know, so
absolutely.
that's the difference, you know.
it's a never-ending payment.
That's right.
That's the lease, there's pros and cons. Yes.
Is there any, and this could be way off, but is there any opportunity to engage all of the veteran, like legions and associations?
I-
Is there any type, like?
I have.
Okay, but I mean, like, from a financial perspective, to kind of support the vehicle?
They ask us for money all the time.
They ask you for money,
Correct.
instead of us asking them.
Hey, do you have any grants or anything that you can come up with to help us, because we're gonna have to close our doors? So I say stuff like, well, we don't have 35,000 veterans in Chautauqua County like we used to. You're gonna have to consolidate some of your clubs. Like, there's no reason that you should look down the street and see another place, and either one of you can keep your doors open, and to that comes arrows and spears and all these sorts of things, because they remember when the clubs were thriving and you could support 19 American Legions in the county. And our veteran population is 10,000 as opposed to 35,000, and younger vets don't typically go to those places, but no, they're trying to keep their doors open. Most of them have volunteer workers. I mean, it's that sort of thing. Because one of the ideas I proposed was, hey, if we could come up with a way to gift them a van, would they be able to operate it? Then because they'll ask, like, how come we only go on this day and this day? Because you had to pick days, you know, one of those types of things, and it's like, but if you guys wanted to take it over, maybe there's a way we could gift you the van. This is a few years ago when the van still had some shelf life left, and they didn't want any part of that, so. But yes, I've engaged with the Legions, the VFWs, the DAVs, aging veteran population.
Okay,
Okay, thank you.
all right.
Appreciate it.
All right, this brings us to our other, is there any other? I would like to say one thing before we adjourn. I'd like to keep our law enforcement in our thoughts and our prayers, just because we have to. So, thank you. Motion to adjourn?
I'll make a motion.
All in favor?
Aye.
We are adjourned.